Hello, welcome back to another video Q&A. This is Oscar, he's my baby. He's a ginger doll-faced Persian. I just want to show it to him. Come on, sit down, say hi. All right, you gotta go. All right. I know it's been a while since I've done a Q&A, but here we are. Let's jump right into it, shall we? Okay. Again, remember those questions are collected through the day as I work and as I continue to see patients. Those are the most common questions, so I just want to put them out there for you guys in order to hopefully find something that you've been thinking about or you've been questioning and you don't know the answer. Again, do not Google, do not go to WebMD. They know nothing about dentistry. Here we go. Why do I keep chipping my teeth? That's a very good question. Now, the process of thinning a tooth starts with one of it clenching and grinding your teeth. As you rub your teeth together, you're gonna thin out the protective layer, which we call enamel. Enamel needs to be intact, it needs to be sealed, it needs to be seamless in order to protect the inner layers of the tooth from sensitivity to hot and cold, decay, fractures, or cracks. I always tell my patient, crack kills the tooth, which is true. If the crack starts at a certain point of the tooth and continue under pressure from clenching and grinding to travel inside of the tooth, it's like a crack on your windshield. When the pebble hits your windshield, it creates that little contact point, right? And it cracks. If you are not paying attention or depending on where that pebble hit the glass, with the pressure of driving every day and having the wind pressure on your windshield, it will encourage the crack to travel even deeper into the windshield. And before you know it, it goes across the windshield and you have to replace it. It's the same thing with the tooth. So why my teeth are chipping? When you chip a tooth, it's not that instant action that caused the chip. The enamel has to be going through the process of getting weaker and weaker through the years by many different factors, by many different reasons. One of the reasons, like I said, clenching, grinding. The other reason is eating a lot of ice or chewing a lot of ice or biting on pens and pencils. Number three, if the tooth is chipping, it could be due to trauma. You hit the front, especially the front teeth. The back teeth, they can take a lot more stress than the front teeth. Most of the chips that we see, it's all the front teeth. So if you're rubbing your teeth together, you're thinning the enamel, and if you bite on something really hard, like a piece of bread or bite into an apple, that will chip the weak enamel, the thin enamel. It keeps chipping and chipping. So the treatment for it is to come in and shave that thin enamel a little bit so you can land on thicker enamel that can protect your teeth from chipping. So there's no straight answer why my teeth are chipped. Teeth don't just break, there's a reason for it. It's a weakness in the tooth or something that's making the tooth weak. Like I said, either rubbing your teeth together and wearing down the enamel, or there was a filling that's failing, that's not supporting the tooth, and the tooth chips. I hope that answered that question. What should I do about my What should I do about my implant? I'm not sure what that question means. It depends on if the implant is failing, if you're having tenderness around the implant, if you don't feel something is right, or you feel that you have a bad taste in your mouth, or the gums are not healing around the implant, you have to go back to the oral surgeon. The implant failure, it's at the bone level. It has nothing to do with the restorative part. Now, that said, we are dropping implants in my practice, and I'm one of the providers that are actually doing implants. And the failure rate of the implants is almost zero because of the amount of designing and the amount of research that we do before we drop the implant. The technology has advanced so much, but what to do with your implant, if you have any questions about how it feels, definitely go back to the provider that dropped the implant and have them do a CBCT scan and have them examine the bone around the implant, see why it doesn't feel normal or it doesn't feel right. A lot of patients will say that. When do I need my wisdom teeth out? That's a very good question, and I get that almost every single day. And I have addressed this in one of my videos at the POP series about wisdom teeth. I tell all patients that third molars, especially teeth that tucked so far back, and third molars are one of them, sometimes second molars also tucked all the way back, that if you don't breach to keep them clean, if they are not functional, if you're not using it to chew or to break down the food or mince the food, or there's decay, take them out, get rid of them. They're just sitting there. It's basically, I call them the tucked away teeth. They're non-functional, but on top of that, they are accumulating a lot of bacteria. You have decay on them, it's staining. We're constantly harboring on, every time we see you, it's like, keep your wisdom teeth clean. Those three molars are like starting to stick. A stick means it's decay. So we have to evaluate, when we evaluate the position of the wisdom teeth and we found out that you cannot take care of those wisdom teeth, then that's when we recommend for you to take them out. If they're abscessed, if they are growing sideways and impinging on the teeth in front of it or threatening the vitality of the teeth in front of them, then that's Eva, my cat. And then that's when we determine that it's a high risk for you to keep the wisdom teeth, then just keep the wisdom teeth. Then to get rid of the wisdom teeth, I'm sorry. The next question is, do they have to pull teeth to do braces? The answer is no. We used to, the standard of care in the 80s and earlier is to pull 4 to make, they at least pull 4. So they pull 4 premolars to push everybody back and make them straighter instead of spreading the teeth out and then bringing them back like Invisalign does. Instead of that, in order to gain space, they used to pull and push everybody back. And I'm seeing those adult patients that had such treatment and those patients having a lot of jaw issues and tenderness because all the molars are pushed towards the back. We don't pull teeth to do braces. It's unnecessary these days because of the way the technology is, except for severe cases, severe crowding that we absolutely cannot recreate space and realign the teeth. So the answer is no, it's not necessarily needed to pull teeth in order to get braces. Sometimes you do, sometimes you don't. And that depends on the orthodontist philosophy. Some orthodontists are very aggressive, some orthodontists are a little bit more limited as far as their approach. So they will say, you know, no, I can move these teeth without more conservative approach than being so aggressive. So the orthodontist that I collaborate with and I partner with a very, very conservative approach, because I believe, and if you watch my videos before, I believe in the body healing. I believe that we should work with the body and the body is set up in a certain way because that's how the body wants it, if that makes sense. How can I make my baby stop sucking his thumb or her thumb? That's a really hard job for you parents, and I feel for you guys. I typically talk to the child and I tell them that if you don't stop sucking your thumb, unfortunately that thumb is not gonna grow. Do you want one thumb to be shorter than the other? And that trick, I just made it up over the years because I just could not find any way to engage with the child to make him understand the concept of disadvantagement from, you know, thumb sucking. They don't know. They just know that this thumb sucking habit helps them feel very comfortable. You have to be patient with that. You have to be constantly reminding the child that we need to stop that habit. You can do reward games. You can do a calendar, and every day they don't suck their thumb, you can give them a reward, or you can do something fun with them or a treat. The pacifiers are a little bit easier because you can, I just recommend for the parents to just cut the pacifier and say, oh, it's broken, so it's gone, but you can't do that obviously with digits or thumbs. So it's a very, very tough habit to break. One time I was driving to the city and I looked to my right, and probably a young lady that's not older than 25 was sucking her thumb in the car waiting in traffic. So they could continue sucking the thumb for a long, long time. Good luck with that. That's it for today. We're running out of time. I hope to catch you in the next video.